Thank you very much, Professor Li. I believe it's a very remarkable overview and insights into the development of ophthalmology in Hong Kong. It is certainly the first of its kind, and we all enjoyed very much about your sharing of experience and insights into what happened in the past. Now, I think we all deserve some time for Q&A. Please, Professor Li, join me in the podium. So we have some questions from the audience, and the all of you here in the lecture theater are also welcome to raise the questions. And now, before I look into these questions, I have one that I would like to ask. Now, you're one of the pioneers in introducing LASIK and phaco to Hong Kong. We all understand sometimes it's difficult to change people's behavior. It's difficult to change doctors' practice pattern. Back then, what were the challenges when you introduced LASIK and phaco in Hong Kong, and how did you overcome these challenges?
Well, as I said, for phaco emulsification, I liked it. It was very hard to justify it. So by the time I was doing it, it took 6-7 years before. I was doing it regularly in 6 or 7 years. And I couldn't make a difference until Professor Guy Chan started teaching the residents to be doing that and change the whole practice. So my point is that you need some academic leadership, you need a platform, and it's what the residents are going to do later that's going to make a big difference. As for the LASIK, Professor Guy Chan showed me that you need quality control. You need to have a whole system of informed consent and even the concept of patient expectation. You know, you're doing a elective surgery. So it's not just a matter of seeing 20/20, it's the personality type. And that's what Dr. Chang and Kendrick is working on, perhaps dividing certain personality type to see who would be satisfied. But when we started LASIK, we started with a guidance we had. Now, even though Dr. Casebeer wasn't that experienced in LASIK surgery, but he was one of the pioneers in refractive surgeries. So his presence made sure that we had the safety protocols in place. So all this was reassuring to have the system in place for safety. And of course, the important thing that we learned most was the sharing of the learning curve and the review of complications. That, hey, I did this, it didn't work out too well. And some other, we say, John say, well, you know, you're pushing too hard or do this. So all this collective sharing, it's just very important for bringing us up to par. Yeah.
We're indeed very fortunate to have these grandmasters willing to share the experience and to teach young people and to build all these standard operating procedures so that we all can enjoy what we are doing now. We have a few questions from Professor Christopher Liu from Brighton and Sussex Medical School. One interesting question he has is, how do we go about avoiding politics and territorial claims for the sake of advancing ophthalmology in Hong Kong?
Well, you know, like Dr. Li Shifan, my uncle, said, we hope that the international exchange would be a platform for world peace. Now, I think the days are gone for ping pong diplomacy, not when they want to boycott our Olympic, but at least in terms of healthcare. Healthcare, when you talk about health, we should talk about the welfare, not just for the Chinese, but for everybody. Healthcare transcends religion, race. So I think this is our teaching. And if we use this as the main point, this as a guiding principle, then it should transcend all politics. As long as we don't try to bring politics back into it, you know. But at least we can try, you see.
Sure, I mean, genuine love in
A higher purpose, just like God's love, right? So if you think this is God's love, then regardless who you are, you deserve to be saved. For any patient, we try to do best for them, regardless. And that's how I think we can transcend the politics and territorial. As a matter of fact, the politics doesn't really bother the doctors we know internationally too much. I think, at least the doctors I know, we still communicate. They don't care about all this. They don't see this as such. You know, our personal relationship hasn't changed with politics. And that's why I know that we can do it.
It's definitely a very important take-home message. Love transcends politics. Right. So I think, I'm sure some of you may have questions, and I would like to perhaps anyone who has a question you want to like to ask now, please take your chance and take up this opportunity. Now, one question I have about the future in Hong Kong ophthalmology is how do you see Hong Kong Sanatorium and Hospital would contribute to Hong Kong ophthalmic care? How would the Department of Ophthalmology and how would the hospital? We are facing actually a lot of challenges. The waiting time for an ophthalmology appointment is on average 2 years, and the waiting time for cataract surgery is under 2 years. So how would you see the future of Hong Kong Sanatorium and Hospital would perhaps work with HA, work with academics? How can we all work together, as you alluded to earlier in your lecture, to really provide better care of ophthalmology in Hong Kong?
I think the pressure is always in waiting time and numbers. Now that is often, that's always going to be the overriding concern for the government. Getting your numbers, getting your numbers and getting the waiting time down and all this. But Professor Leung, for you and I, we think if we want to maintain our position and recognition, there should be some place where we can look further than just the numbers. We are looking at the tough cases, the subspecialized cases, and that's what we need to work together. Now, it's not impossible. I'm not trying to advertise, but of course, you know, we are built in a proton therapy. It's something that we like to share with the public. But even before that, the radiotherapy machines that's available in the government hospitals are quite ancient. So we have all this new technology. And we are working with Hong Kong University. They have staff over there to send patients for those things. And because of the university involved, there are donors to help these patients to come from Hong Kong U to get the prostate cancer treatment for MRI clinic. So with the whoever controls the money before, well, when you want new equipment, they're going to question this new equipment, this new model, how much better is it? Is it worth the upgrading? And if I upgrade you, I'm going to upgrade the 20 other hospitals to be fair. So that may be a challenge. But we can surpass this if some of the residents or doctors can have access to new technology. So, well, you can say the public hospital should not provide refractive surgery. However, as a department head, wouldn't you like some of your doctors to also be familiar with refractive surgery? It's a very big part of ophthalmology. So you see, you cannot have try to develop all parts of ophthalmology where they hamper you on equipment or from certain practice. And that's something that we can do, I think.
Right. We definitely are looking forward to fostering a closer ties with Hong Kong Sanatorium and Hospital, and also with other parties to strengthen and augment our capacity to ophthalmic care delivery in Hong Kong. I think time is almost up, and if we don't have, okay, we have one question from Professor Lam.
Professor Li, it was a wonderful lecture and a great journey to the past to remind us what our future holds. And you mentioned in one of your remarks is that Hong Kong is a small place and you have two universities. And you alluded Hong Kong is a small place, you have two universities. And you have alluded to the fact that there should be more collaboration. So I would like to hear your advices to the leadership in the two universities, because we often compare between each other. And we, in many times, people look at it as a rivalry, a competitor between the two universities. So what would be your advice to the leadership of the two universities to get together to, as you say, strengthen Hong Kong as a whole healthcare rather than two separate entities trying to compete to each other?
Thank you, Professor. My message, I think, is that when I sit here and look at what's happening in the world, that the world divided and Hong Kong isolated, I think this is no longer just a turf war. I think for the sake of our reputation, for the sake of Hong Kong, people just want to see Hong Kong not thrive. If we are to thrive, we have to work together. And I think this is just a mindset. We have been so used to the mindset of, oh, I am HJ, oh, I'm Queen Mary, oh, this is just a mindset. Because there's no trust, no teamwork, and no teaching. So perhaps the 3 T's starts with cross-teaching and exchange, and then look at the teamwork and get the trust. That's the 3 T's of Professor Gai Chan. Territorial, as I said, is just a mindset. You have to think, look further ahead. The unified goal is that how can we now thrive together to bring us up together? If we can do it properly, if we can thrive together, then our doctors will be always well respected within China, within Asia, and then everybody will benefit from this, rather than people to say, oh, you know, your Hong Kong is nothing special anymore. You are just being swallowed by the Greater Bay Area, you see. You're just a part of China. They try to stomp on us. And I tell you, I think Hong Kong is still special in the sense that we still have international connection. We are still free to interact with any country in the world, regardless of politics. And we do have this freedom, and we better make use of this freedom. And because it's still limited exchange, we should get together to join this exchange to make it worthwhile.
Thank you.
I think excellent summary of today's lecture. I really look forward to building bridges with CHK. My relocation here is actually, I think, a very good opportunity to build up a common platform that we can learn together, we can grow together, and with the support from Professor Li and the Hong Kong Sanatorium Hospital, I am really excited to the opportunities ahead of us. So with that, let's give a big applause to Professor Li again. Thank you very much.
And I also think that what we couldn't do before, at this time, we can do it. We couldn't do before, but at this time, I think it's an opportunity that we can do it together.
That's right. May I now invite Professor Leung forward to present a souvenir, a plaque of recognition, appreciation to Professor Li. So I'm sure you'll enjoy this evening. Thank you very much. And I look forward to seeing you all in our next quarterly lecture. Thank you.